So you want to know how to take sildenafil for maximum effect. Now, sildenafil, also known as Viagra, is used for health problems like erectile dysfunction, which is when you have problems sustaining an erection hard or long enough for satisfactory intercourse. Now, sildenafil or Viagra was never intended for recreational purposes and was previously available only on prescription, and you had to fulfill certain criteria, such as if you had underlying health problems like diabetes or neurological conditions such as Parkinson's or multiple sclerosis. However, it is now available over the counter. It's easily accessible for anyone to buy. You only get asked a few questions before you're given the medication. So sildenafil is a PDE5 inhibitor, which means it inhibits or blocks the PDE5 enzyme, which allows for increased blood flow to the penis and relaxation of the smooth muscle that allows for erection to occur. Sildenafil comes in different doses. You have the 25 mg, 50 mg, and 100 mg dose. Whichever dose you take, do not expect any immediate reaction when you take the medication. So it usually takes 15 to 60 minutes for it to work. So therefore, take the medication 15 to 60 minutes before you have intercourse. But of course, if you're older, it might take things a little longer to kick in. And also, you then get hard without any form of stimulation or foreplay, but every man is different. Now, for older men, especially above the age of 65, I would normally start with a lower dose of 25 mg, and then I'll gradually titrate the dose according to response. Just be aware that do not expect any immediate effect with taking just one dose of the medication. It can take up to 3 to 6 doses to obtain a maximum response, and in some cases up to 8 doses to obtain a maximum response. However, 25 mg of Viagra is only shown to have a 25% response rate in men. For younger men who are fit, no health problems, you can actually start with the highest dose, which is 100 mg, and then down titrate downwards according to the medication dose that gives you the best response and least side effects. But I would usually start with 50 mg because I can then increase to 100, or I can reduce it to 25 mg, again depending on any side effects and maximum response to the medication. But whichever dose that I give, I'm not expecting any immediate benefits, and I would normally advise you to persist for at least 3 to 6 doses before titrating the dose, whether it's going up to 100 mg or going down to 25 mg. Common side effects to expect with Viagra will be blurry vision, or you might have blue-tinted vision where things might appear blue to you, and this is peculiar to Viagra compared to other medications such as Cialis or Levitra. But there are common side effects with all the other drugs, which include dizziness, headaches, flushes, blocked nose, as well as other milder side effects such as maybe fatigue. But if you have chest pains, you better stop the medication and let the doctor know. Also, just be aware of interaction with other medications. So you might be on medications for heart problems such as nitrates, which are also known to increase blood flow by causing dilatation of the smooth muscle. This can lead to a risk of having low blood pressure, which can cause fainting spell. Also, if you're a man and you've had a recent stroke, unstable angina, or you have very high or very low blood pressure, then speak to your doctor, because it's most likely that you will not be able to take the drug at the present time. Now, I hope you've understood how to use sildenafil, otherwise known as Viagra, how to use the medication to maximum effect, and if you have any other questions, please feel free to drop comments below.